I've been practicing for 20 years in Ohio, and Wilson Health attracted me because it's this community hospital with a very supportive medical staff and supportive patient community. And I feel we could provide a service to a community that's required so patients don't have to travel for ENT services. Hi, I'm Michael Vietti. I'm an oh-toe-lair-in-goll-oh-ghee at Wilson Health. Oh-toe-lair-in-goll-oh-ghee is also called ENT for short. We're a specialty that deals with disease of the ears, nose, and throat, and the head and neck. Oh-toe-lair-in-goll-oh-ghee appealed to me because it was also very diagnostic challenging in terms of some of the medical stuff we do, and even surgically challenging some of the diversity of surgeries. Everything, again, from routine surgery to very complicated microscopic surgery, intricate surgery, to very advanced head and neck surgery. So it encompasses the whole spectrum of surgical skills, which really appealed to me as a surgeon. The most common procedures we do in a community hospital are all these pediatric surgeries, tonsillectomies, ear tubes. Again, those are the most common surgeries worldwide in children. And then in adults, one of the most common things we do are sinus surgeries, advanced sinus surgeries. We have an image-guided surgery system, which is pretty much state-of-the-art, so we can perform surgery safely in adults to eradicate sinus disease. Another more common surgery we do is thyroid surgeries. Thyroid disease is very common in adult patients. Most thyroid nodules are benign, can be managed with medical observation. However, those that are suspicious or larger, or cause airway deviation, or if patients are concerned, require surgery. And again, that surgery is a very delicate surgery, mostly because the nerve that runs the vocal cords runs right through the thyroid gland, and so it has to be meticulously done to avoid injury to that nerve. Typically, in our practice, my nurse or medical assistant greets the patient, takes their history, enters in the computer system, and then I review it with her before I come into the room. I introduce myself to the patient, get the history in their words so I know exactly why they're seeing me for, because sometimes patients will want to see us for something else as well too, and they'll elaborate more on why they're seeing us for. And then of course there's a detailed head and neck examination where we look at the ears, nose, and throat. And then of course, depending on that, we either do diagnostic testing. For instance, we do audiology services here. If people have hearing loss, we do them on demand while they're here in the office. And then of course they need other procedures done. We can do biopsies here in the office, endoscopies here in the office, and if they need further testing, we can arrange that before we evaluate that further. And when we're seeing pediatric patients, we examine the child, and most of it's discussing treatments with the parents. We can do most of the surgeries here, routine tonsillectomies, routine ear tubes, even neck masses. The anesthesiology service is very capable here, as are the nurses, and we have the latest equipment. And so most patients can be operated on here in Sydney and don't have to travel elsewhere for care, which I think is very convenient for families, because I've had small children myself in the past, and it's hard enough to travel with small children, but to travel for a medical procedure, and especially if the child has issues afterwards and the follow-up care, it just makes it more convenient for the patient and the family to have surgery done here. We're a full-service practice. Our staff is very well trained. They know how to manage patients, how to discuss things with patients. And also, one of the nice things too is because they've been here for a while, they understand what's urgent. So when a patient calls with certain conditions, or a family physician calls, they know it's urgent. They can make an urgent appointment for the patient, sometimes the same day if it's an emergency, or within a couple days, so we can see the patient quickly and get a treatment plan going without having the patient wait a long amount of time, which as a specialist, when I refer patients out, can be very irritating if patients have to wait a long time to see a specialist. So we try to avoid that if at all possible.